This is your Houston Chiropractor Dr. Gregory Johnson. Look who's back, Shekinah, and look how she's standing up straight as an arrow right now. This is her 8th adjustment here at Advanced Chiropractic Relief since she had a severe, huge herniation at L4, L5. Now, she kind of has a interesting case because not only did her nucleus pulposus herniate posterior left lateral and pinch on her sciatic nerve, but she actually fragmented a piece of the annular fibers, which is the outer covering of the disc. That's the ligament. It's the toughest ligament we have in our bodies. And that fragment is actually laying on her L5 nerve, which comes out between L4 and L5. That goes all the way down into her legs and into her feet. So the very first day that she kind of came in here, she was all spazzed out in an antalgic posture. We've gotten a lot of her biomechanical stuff corrected. However, she's still having the nerve impingement because she has a fragmented herniated nucleus pulposus and annular tears that's lying on the nerve. So we have her getting we had her get a neurosurgical consultation with one of the prominent Houston neurosurgeons that we deal with and work hand in hand with for our patient's best interest. And she's having spine surgery on that L4, L5 disc on Friday morning. So keep her in your prayers for that. You know, some people get completely well with this, and there are others, if they have a fragmented herniated disc where the fragment's laying on the nerve, there's no amount of adjusting in the world I can do to take that away. So, you know, there is a need for surgery in certain cases, and Shekinah is one of those cases, and we hooked her up with the best here in Houston to do that. So we just keep her in our prayers for that, and we're still hoping for a miracle between now and then. Let's have you flex forward and backwards for me, and then neutral. But we really appreciate her sharing her story with you because she went from being the hunchback at Notre Dame that first visit to being all full of Shekinah glory now. Okay, here we go. That's her name is Shekinah. I just, you know, all of you who know the scriptures know that Shekinah glory is the smoke-filled room that God speaks to people in. That's where they see His glory, right? Shekinah glory. That's manifested presence of God right there, yeah. There we go, dude. There we go. Yes, ma'am. We're still hitting homers, aren't we?
Yeah.
And look here, she's still kicking too, so you can't just tell if a person has diminished reflexes whether they're going to have surgery or not. You actually have to get in the in-depth reads on MRIs and radiology and surgical opinions from licensed, competent, reputable surgeons. Did you feel comfortable with Dr. Seck?
Yeah.
Yeah.
A lot.
He's a real straight shooter too, isn't he? Yeah. Well, he knows if I send somebody over to him that is serious enough that he needs to really take a close look at it. Let me help you up here. There we go. Because we try to keep people from having to have surgery or injections and medications as much as possible, but sometimes that's just not possible. So we have to work together with them for your best interest in those cases. And I don't feel our treatment on Shekinah has been a failure by any means, because you've at least been able to live a more normal existence than you were before you came here, right, Shekinah?
Yeah.
I mean, you able to start playing on your phone games and stuff I saw you doing the last couple of times in here. Living life a little bit better. So, you know, I don't feel that this has been a wasted treatment on her. Sometimes you just need more. Now see, I mean, she's got all negative tests there. Everything's working the way it's supposed to biomechanically, but that fragmented disc is still laying on the L4, L5 nerve, it's L5 nerve specifically. And she's only going to get relief through a surgical non-decompression on that because of the fragment of the disc actually laying on the nerve. Let's turn you on your back now. You notice I'm not sticking my elbow in her lateral thigh anymore, just because it's not really going to do anything to propel her condition forward by me doing that. So I'm not doing this. Slide down this way a little bit. There you go. Perfect. Okay. Okay. I'm just going to pull from down here. There you go. Atta girl. Okay. Yeah. Let's turn that away if you don't mind. Oh, you're sure moving around a lot better than you used to.
Yeah. I had lunch with one of my best friends. I haven't seen her since May, and she commented on how well I was looking.
Well, that's good.
She couldn't believe how straight I was.
Yeah. You have improved tremendously in your biomechanics, but we still got that fragment on that disc, and this is pinching that nerve. So off to surgery we go on this one. But we're still praying for a miracle to happen between now and then. We don't ever give up on that. Don't ever give up on God. There we go. Good. Okay. There we go. Okay, let's have you flex forward and backwards and neutral. That girl. I'm not gonna poke your hip today.
Okay.
Okay. Try that again, see how this feels. Good. So what would you share with our crack addicts around the world about your experience here at Advanced Chiropractic Relief? Even though this has not prevented you from having to have surgery, what would you tell them about how it has improved the quality of your life?
Yeah, I mean, it's improved because I can stand up a lot better. I'm able to walk for longer and be more social. So yeah,
Go have lunch with your friends.
go have lunch with my friends and not be completely like this the whole time.
Yeah.
So
Well, thank you for sharing your story with everyone again.
Thank you.
And
for
we're with
helping
you
me.
in prayer all the time. I'll probably be there in person too. This is your Houston Chiropractor Dr. Gregory Johnson coming to you from Advanced Chiropractic Relief in Houston, Texas with Shekinah today. So be praying for her for Friday morning. Thank y'all. We'll see y'all soon.